No matter that poll after poll shows the American people do not want it, especially if federal funds go to pay for abortions. No matter that even reliably liberal Massachusetts voted for the Senate candidate who said he opposed it. The Obama administration and the leaders in Congress continue to push for faulty health care reform. This is the Focus Action Update. Hi, I'm Stuart Shepard, along with our federal policy analyst, Ashley Horne. Hi, Ashley.
Hi, Stuart.
The president says this is his new plan. Is it new?
You know, it's not really new. In fact, I do want to mention the Wall Street Journal said that the president's plan managed to take the, quote, worst of the House and Senate bills and combine them into something more destructive. So that's kind of the layout for what they think the president's plan is all about. And really, they're right. What the president did was basically tweak the Senate-passed version just a little bit, which means, more importantly, that abortion funding is still in the bill.
All right. Well, after months of Democrats meeting behind closed doors, after having these little writing sessions where no conservatives were allowed, after bringing the bills out just hours or days before they called for a vote on them, suddenly we're talking about bipartisanship on the Hill, which ordinarily we'd be happy to hear about. But are Republicans really being included in this process? Are other points of view seriously being considered?
You know, tomorrow is the Health Summit. The president has called saying, you know what, we want to have bipartisanship here. I want to listen to Republican ideas, which I might add have been laid out quite a lot. They've been on the GOP website. The president knows what the GOP is offering already. But he wants to have this healthcare summit to say, you know what, I'm going to take some of those ideas. The problem is he's already got a plan laid out. He released it this week saying, here's my 11-page proposal that basically just modifies the Senate version and leaves in most of the really bad provisions. I mean, let's go back to the Wall Street Journal saying, you know, the worst of the House and Senate provisions have been included into the president's new proposal. Right. And so I think you'll also see, and you've seen this week, the GOP coming out both in the House and the Senate saying, you know what, this is disingenuous of the president to invite us to this summit and not really want to listen to our advice and our proposals. And so it'll be very interesting to see how this healthcare summit plays out. I do want to quote the Wall Street Journal one more time. They said the larger political message of the president's proposal is that he and the Democrats have no intention of compromising on incremental reform. So, I mean, it's not hard to see that this healthcare summit is really looking more along the lines of a political play rather than a genuine effort to really put together healthcare reform for the public. Okay,
so let's lay all this out. You've got the Democrats who have been meeting secretly behind closed doors, hammering out these plans, rushing them out to the floor, saying, let's vote, let's vote. Now suddenly they're saying, oh, we're going to invite the Republicans in because we want bipartisanship. There's way too much partisanship on Capitol Hill, they say, but when the Republicans get there, there's already a bill on the table. What is this summit really about? What's the purpose of it?
I think that's the big question, and in my opinion, and I think a lot of people's opinions, this is just looking more and more like the president just wants to pay lip service to the idea of bipartisanship. We hope that's not the case. We hope that really when they come to the table tomorrow that Republican ideas will be heard. I mean, this is a very big decision. Overhauling our nation's health care reform is a huge issue, not to be taken lightly and not to be rammed through by one party or another. And so this healthcare summit could be a really good thing, but it's looking more and more like it's just kind of lip service at this point.
Okay, I'm going to ask you to be geeky for a minute. A word that we're going to be hearing a lot over the coming days is reconciliation. Now, that's a word that in real life most people have a positive feeling about. Oh, reconciliation, good. Describe what it means in this context. What are they doing?
You know, the easiest way to think of it is it's just basically a budgetary process that allows for 51 votes in the Senate. So that would mean that the Democrats don't need to meet that 60-vote threshold to pass a bill. And that's concerning because as we saw in Massachusetts with the election of Scott Brown, we were really encouraged by the fact that now the Democrats didn't have their supermajority. So again, going back to the healthcare summit, that's one more thing that makes the healthcare summit look a little disingenuous, because at the same time that the Democrats and that the president are calling for bipartisanship, they're also in the back rooms and really publicly kind of saying, we're still going to use reconciliation. So we'll come to the table and we'll listen to your ideas. But at the end of the day, we're going to use a process that's not used very often, especially not on big pieces of legislation like this, we're going to use this process and ram it through anyway.
And it's going to be a tedious process? Is that the
picture?
It
is kind of a tedious process. It's a lot of procedural rules that we don't want to get into here, but basically what's important to know is that it's just a simple majority vote, and that should concern Americans because it is a budgetary process. This is not a budget bill.
Right.
This is something that's, again, overhauling our healthcare reform system, and we really want to make sure that they take it seriously. And so those procedural hurdles that are in place, like 60 vote thresholds, those can be really good things, and in this instance I think they really need to leave those in place because this is an important issue that you want debated a lot.
There's something you've referenced a few times in our conversation so far, and I want to put it in stark clarity. We're going to go back to September. This is a promise, a statement, a blanket statement that President Obama made in his address to a joint session of Congress.
And one more misunderstanding I want to clear up. Under our plan, no federal dollars will be used to fund abortions.
Ashley, under the President's plan, the one that he's bringing to the bipartisan summit, the one that he put together, will federal funds go to pay for abortions?
The short answer is yes, and here's why. The Senate version is basically matched with the President's proposal. So if the President's proposal didn't change something in the Senate version, and in this case it didn't change abortion funding, then the Senate version controls. And so we know that in the Senate version that they passed, it does include abortion funding. It includes subsidies for people to get abortions. And also, one thing the President did add, which is very interesting, he added another $4 billion for what's called community health centers. And the current concern there is there was no restriction on that money going to health centers. It can't be used for abortion. There was no restriction like that at all, which means, as we know and we've seen in past years, when you don't specifically say this money, this federal money, cannot be used for abortion, it goes to abortions and abortion providers. Yeah. And so that, I just want to point out, the Abortion Access Project has already released a memo telling these community health centers how to integrate abortion into their practices. And that's something that we want to point out the National Right to Life has really made a big issue of, caught that in the President's proposal, and that's yet another thing. So honestly, the President's proposal not only kept abortion funding in, it kind of expanded it in a way that I just mentioned here.
All right. Well, Ashley, thank you for tracking this for us, and thank you for sharing your expertise with us.
Thanks for having me.
And thank you for watching. We appreciate your comments, your questions, and your criticisms of what we do here. You can always write to us at citizenlink@family.org. Remember, stand tall and be heard.